Dr. Will Jemison. I'm the CEO of JAMHI Health and Wellness here in Juneau. JAMHI Health and Wellness is an integrated care provider in that we provide both behavioral health services as well as medical services for the community across Juneau and all of Southeast Alaska. We have been in Juneau since 1985, and last year we serviced over 33,000 individuals with services within our community. Yeah, I was here tonight because I want to just, as much as I can, inform our community about the changes that are projected to come because of HR 1, or commonly known as the One Big Beautiful Bill that was passed in July of this year. To let people know that, yes, there are some barriers that could potentially be within that legislation impacting Medicaid and SNAP and a number of other social safety net programs, but also that there is a distinct number of opportunities that exist within that legislation that would allow, to a greater extent, organizations like JAMHI and some of our other social service partners within the community to really collaborate to have a very positive impact on our community and our neighbors. Yeah. So talking about the impact to Medicaid in particular and SNAP benefits, JAMHI services about a 60% mix of individuals who have Medicaid as their primary insurance. And so wanted to just talk about the impact to Medicaid as a federal and state program to let people know kind of what state of play we're in with Medicaid. You know, how, which communities are going to be impacted with this, ways to mitigate some of those things, one in particular being the work requirements, that there are several other areas around the work requirements that people can, if they're enrolled in the right services, to find the right avenue to meet that qualification and remain on Medicaid if they so desire. Also talking about the impact to safety net programs like SNAP. There are a number of proposed qualifiers now for SNAP that are out there, and coming to a place like JAMHI where we have a very aerial view of all of those services, and we can provide assistance to individuals who have questions or who might need assistance in filling out the proper paperwork. We can do all of that for you, but we want to let the community know that that is something that exists and that is out there for them. I don't want people to leave here tonight and be concerned that they may lose benefits. If we collaborate together and we inform as we should, individuals should not experience a disruption to their benefits. If anything, they will have a more engaged view of how best to utilize the benefits that they have and also improve their own health outcomes. Yeah, each one teach one. And by that I mean, if every time you hear about some potential impact because of this legislation, and you know someone that has a potential challenge with it, encourage them to seek out that information. If you don't know personally how to find that information to provide to them, or they don't know how to find that information, by all means have them to contact JAMHI. We're here to assist. And that extends to people who are not our clients, who are not patients of ours, to call us, and we have a dedicated team that will answer the questions that people have. We've been working with the State Department of Health. We're working with a number of our other statewide and local partners to provide detailed information so people know well in advance of these changes happening, how to prepare and how to respond. I would just encourage the community, if you don't have a medical provider of any sort, JAMHI is a federally qualified health center. We operate at the highest of medical standards. I encourage people to seek us out for all of their medical and behavioral health needs. We have walk-in services that are available as well as appointment services. We also offer telehealth services. If anyone needs any sort of behavioral or medical service, JAMHI is here to assist. We do it on a sliding fee scale, so you never have a concern about having a high bill after getting the care that you need. Our main purpose is to serve the community in the most affordable manner that we can.